Okay, sometimes the organisms move about. Tiny little worms that are a big problem for school kids. You probably know a bit about this one. The worms come out of the anus at night. There's plenty of pictures on screen. And lay their eggs around the anus. Then they go right back up inside the gut and normally hide somewhere like the appendix. The symptoms of the kids are tired and irritable and itchy at night because that's when they see the worms.
Question, what happens if it does get into the appendix?
It doesn't affect the appendix, but there have actually been cases of pelvic inflammatory disease where it's gone up the wrong way and got into the fallopian tubes and things. The eggs that we're looking for, so if we may, but very unlikely, find eggs in faeces because they're normally laid outside to find the worms. See the little wormies there? There. Because we don't get the worms or the eggs in the stools, we can ask for a sticky tape, in which case before the kid has wiped their bottom in the morning, you put a piece of sticky tape against that and you can pick up any eggs or worms on the surface before they've all gone into hiding. And this is actually what the worms look like. And that's inside a worm. And you can see all the eggs inside the worm. And you can get an idea of how many eggs this worm is capable. It spreads in a different mechanism. It just basically sheds thousands of eggs every night because the kid will pick them up under their fingernails and take them to school the next day for them. And they're also, they don't require a second host, and they're also ripen very fast, so it's quite easy to reinfect yourself as well. The case in point is worms. Earthworms look very much like these things, and all the earthworms and terrestrial flatworms love warm, moist, organic matter. That's where they live. So if you have a baby in a nappy, which has been very nicely filled by the baby, sitting outside in the dirt, an earthworm's going to look at that and say, "Oh, heaven," and move in. And mummy's going to unwrap that nappy and go, "Oh, hell!" Okay, probably just an earthworm finding himself a nice home. These roundworms are not too common down here, perhaps in northern Australia, yes. But given the status of things down here, chances are it's actually going to be an earthworm or a flatworm or an annelid of some sort. But again, the main thing is to reassure the patient things will be all right, and the doctor has the responsibility of letting her know that she's just being a little bit overprotective. Okay, so that's what the adult roundworm looks like. And they don't normally cause too much of a problem because they just eat a little bit of your food. However, when you get them in this sort of numbers, they can actually block your intestines off, and then that could be a problem. But like I say, with normal hygiene, especially in Australian conditions, we very rarely get this sort of thing. If you have a blockage, it may sometimes spontaneously clear. Sometimes they will need to surgically put a suction or a hook or some sort up there to remove them. And on that note, they can occasionally come through the mouth or nose as well, or be vomited up. They do live in the lower intestine most of the time, sometimes in the upper intestine. So if you get a severe gastro, you can vomit them up. And you know, when they just feel like migrating, they just feel like migrating anyway. But normally they will be shed through the other end. But normally they actually sort of attach to the wall and stay there for a while. So normally we would only see the eggs which are. You see these ones, you know you've got at least 2 worms because that egg's been fertilised. If you see only these ones, it could be that there's only one little female there without a partner. Because a lot of the worms don't show symptoms at all because they are so adapted to humans. They're not going to want us to get rid of them, they want to be able to spread to another human. So they're going to try and stay below the radar. It's only when things get out of hand because they're reinfecting themselves all the time or something like that, that you do tend to get larger numbers present, and then you have them, it will get rid of them. Your standard Vermox, or any of those ones that contain metronidazole, will get rid of those pinworms and the roundworms, and pretty sure the tapeworms as well. There's treatments for all the standard worms that just live in your gut and don't do much. When it comes to the parasites that live outside the gut, it's not an over-the-counter type thing. You really need to have carefully monitored treatment because when they're killed, the body can react a hell of a lot more damage. What happens is you will find one member of the family will show something, just be picked up as a consequence of something else, like a kid might have diarrhoea from Cryptosporidium from a swimming pool, and we'd see the worm eggs at the same time. So we'd say, well, treat for worms while you're at it. Some of the antibiotics that cover common infections cover other things as well, like you might have erythromycin for an eye infection and get rid of your chlamydia. All with parasites is if one member of the household has it, the rest of the household is most likely to be exposed and most likely have it as well. So you should treat the whole household as well. This is often the problem with why these infections persist in schools and things, because Mary is treated one night, goes back to school and gets it from Johnny, who's treated the next night, who goes back to school and gets it from Mary again. Unless all the kids are treated at once, it's going to persist.